Report number 28. At the 4-hour examination, there is an insignificant amount of gastric residue. At that time, the head of the barium reached the distal part of the colon. There are along the sigmoid. At the 24-hour examination, one can see that most of the barium had been evacuated. The residue is scattered over the colon. That reveal the nature of the shadow adjacent to the heart on the left side. The presence of a herniated kidney or splenic flexure or stomach could not be substantiated. Report percutaneous kidney biopsy is most valuable in differentiating pure and mixed nephrosis early in the disease when symptoms are equivocal. Differentiate because every child with pure nephrosis should have at least one course of adrenal steroids or corticotropin regardless of duration of disease. On the other hand, the nephrotic syndrome associated with primary chronic glomerulonephritis may be exacerbated by such therapy. Report number 30. Examination of the chest and lumbar spine, including both hips, reveals no evidence of metastases or any other destructive pathology. The lumbar spine and lumbosacral curve is accentuated. Report number 31. Tumors not related to the parotid gland or the pancreas seldom produce amylase-like substance. Specimens of lung carcinoma show little significant amylase material. Even when the fluid amylase value is high, tumor amylase may be only slightly elevated. Possibly, the amylase-like substance originates in the lungs. Lymphangitic carcinomatosis of the lung, in particular, is associated with high amylolytic activity in pleural fluids. Back pressure in the lymphatics may result in leakage of the amylase-like material into pleural cavities. Osteomyelitis or any destructive pathology. There is evidence of osteoporosis. The pelvis shows evidence of a bullet in the projection of the left lower pelvis underneath the skin. Report number 33. Examination of the genitourinary tract by means of an intravenous pyelogram reveals as follows. Both kidneys are well visualized. They are normal in size and shape and somewhat lower in position than the average. Following injection of 20 cc's of diodrast, the dye appears promptly in the pelvis and calyces on both sides. These structures are normal. The visualized parts of the ureter are also normal in width and outline. There is a calcified focus in the left pelvis, which is outside of the genitourinary tract and probably represents a calcified gland. The urinary bladder shows nothing remarkable. There is scoliosis of the lumbar spine with the convexity to the patient's left. Report number 34. Induction of labor, whether elective or necessary for medical reasons, should be done only in institutions with adequate facilities and personnel for constant observation and by physicians with wide experience in method and choice of patients. Hazards of the elective procedure are uterine spasm, fetal distress, postpartum hemorrhage, prolapsed cord, premature separation of the placenta, and delivery of a premature infant. Report number 35. Radiographic examination of both hips reveals no evidence of pathology. Particularly, there is no evidence of pathology involving the right hip. There are heavy metal injections in both gluteal regions. Report number 36. Dilatation of the pulmonary vessels of the upper zones and constriction of those of the lower zones, visible on a plain chest röntgenogram, are characteristic of left ventricular decompensation and may precede onset of symptoms. The pattern is also seen with other causes of pulmonary venous hypertension and sometimes with basal bronchiectasis or emphysema without pulmonary venous hypertension. An exception to the typical pattern is noted in patients with extensive pulmonary emphysema or chronic bronchitis. With these conditions, both lower and upper lobe vessels are dilated. Report number 37. The stomach is of an elongated type. The mucosal pattern presents a mottled appearance, most likely due to residual food. There is moderate and uniform dilation of the stomach. The pylorus is spastic. However, it shows no evidence of ulcer or neoplasm. The duodenal cap and the adjacent part of the duodenum show irritability, and there is a huge diverticulum in the third portion of the duodenum. Some of the jejunal loops are markedly dilated. The cause of this finding is not indicated on the X-ray film. It may be due to a partial obstruction, or it may represent reflectoric changes secondary to extrinsic pathology. Internal hernia, vascular obstruction, and pathologic glands should be taken into consideration. Repeat of the small intestinal study would be advisable. Lordosis of the lumbar spine with advanced arthritis between the 4th and 5th lumbar vertebrae is noted. Report number 38. If the diverticulum has perforated and sealed, any resulting abscess should be drained. If the condition of the bowel wall permits, the diverticulum may be excised. However, if a fistulous opening into an abscess cavity has formed, drainage and closure of the perforation. If the perforation cannot be closed safely, the bowel may have to be exteriorized. Report number 39. The right hand shows an area of increased density adjacent to the proximal end of the proximal phalanx of the right thumb. This finding represents a cortical type of fracture or a calcifying bursitis. Report number 40. In patients with glomerulonephritis, the inulin clearance test correlates well with the degree of glomerular damage in biopsy specimens. The highest correlation is with the degree of glomerular cellularity. The less the reduction in renal function during the acute stage of glomerulonephritis, the more rapid the return to normal. However, functional and histologic changes early in the disease may be extensive without necessarily indicating a poor prognosis. Report number 41. The cervical spine shows marked arthritis with spurs on the vertebral bodies. Some of the spurs project in the intervertebral foramina. There is no evidence of pulmonary pathology. Report number 42. In contrast to other malignant neoplasms, carcinoid tumors have a slow rate of local spread and metastasis. Most never spread beyond the confines of the primary lesion. The carcinoid tumor is the most frequent neoplasm of the small intestine and usually originates in the terminal ileum. Incidence of metastasis increases as the primary lesion, which usually is small, enlarges. Multicentricity of origin and coincidence with other primary malignant neoplasms are common features. Report number 43. Examination of the chest shows no evidence of tuberculosis or tumor involving the lungs. The diaphragm and costophrenic sinuses show nothing remarkable. Report number 44. When pathogenic enteric bacteria enter a biliary tree in which the flow of bile is obstructed, rapidly developing septicemia almost invariably leads to death unless the biliary tree is decompressed and drained promptly. Organisms may be found in the bile in any chronic or acute inflammation of the gallbladder or biliary tree, but are isolated most often when the bile ducts contain stones. Report number 45. The gastrointestinal tract reveals a small diaphragmatic hernia with no evidence of any other pathology in the same area. The stomach is of fishhook type. In the juxtapyloric area, there is a niche at the greater curvature site. It is not indicated on the X-ray whether it belongs to the duodenal cap or to the pylorus. Therefore, no suggestion can be made as to whether the finding represents a benign or a malignant condition. A comparison with the films taken previously would be advisable to furnish additional information in this respect. Films of the small intestine, taken at intervals, fail to reveal any evidence of pathological change. At the 24-hour examination, the barium is in the colon. There is a narrowing of the lumen in two short segments of the sigmoid. This region, however, an infiltrating type of lesion in this area cannot be ruled out. A barium enema would furnish additional information. Report number 46. When exterior examination fails to locate a testis, laparotomy is necessary to determine whether the testis is missing or concealed in the abdomen. Because of probable malignancy, an abdominal testis should be placed in the scrotum before puberty, if possible. Otherwise, it should be excised. Report number 47. The lung markings are accentuated in both lower lung fields, and both hylae are increased in size and density. These changes suggest bronchitis. Report number 48. The esophagus is normal in appearance and function. The fundus of the stomach shows a cascade with no evidence of any other pathology in the same area. The remaining part of the stomach is of fishhook type with a normal tonus and peristalsis. There is no evidence of ulcer or neoplasm. The duodenal cap and the remaining part of the duodenum are normal. At the 24-hour examination, the barium is partly in the colon in scattered distribution. The hepatic flexure is well visualized and normal in appearance. Report number 49. The inguinal canal is explored through the obliquus externus aponeurosis. The incision is placed well laterally to permit entry to the iliac fossa by splitting the obliquus internus and transversus muscles. If necessary, the peritoneum is opened to admit a finger to probe for the testis or the vas deferens, which may be found by palpating the pelvic wall. Report number 50. Examination of the abdomen shows a single pregnancy. The measurements of the maternal pelvis are as follows. Transverse diameter 11.2 cm. True conjugate 10.1 cm. Base of the pelvis 11.6 cm. Height of the pelvis 9.7 cm. Biischial diameter 9 cm. Circumference of the fetal head 32.5 cm. Sphere volume of the transverse diameter 735 cc. Sphere volume of the true conjugate 520 cc. Sphere volume of the fetal head 578 cc. There is no disproportion between the maternal pelvis and fetal head. The pelvis is of gynecoid type. The lumbosacral curve is somewhat accentuated. The sacrococcygeal alignment is straight. The retro and infrapubic angles are broad. Report number 51. All patients pregnant with twins who have had cesarean section previously should be admitted to the hospital 1 month before term. Then, when spontaneous labor begins, cesarean section is performed. Obstructed labor owing to transverse presentation of the first twin, or, rarely, cephalopelvic disproportion or interlocked twins necessitates cesarean section. If the second twin is in the transverse position, vaginal delivery usually can be accomplished by internal podalic version and extraction after delivery of the first twin. Report number 52. Intermittent peritoneal lavage is a simple and effective means of artificial renal dialysis. Although less efficient than dialysis using the artificial kidney, the procedure can be performed by any physician with hospital and laboratory facilities and requires little equipment and few personnel. Commercially prepared fluids and a disposable lavage apparatus now are available. Report number 53. The gallbladder reveals a large calculus in the fundus. It is lodged in the distal compartment of a so-called septum gallbladder. The dye appears in the proximal compartment. The esophagus is normal in appearance and function. The stomach is of fishhook type. The mucosal pattern represents somewhat enlarged and tortuous rugae. This finding suggests gastritis. There is no evidence of ulcer or neoplasm. The duodenal cap and the remaining part of the duodenum show marked irritability. However, there is no evidence of a duodenal ulcer. Films of the small intestine taken at intervals fail to reveal any evidence of pathological changes. The emptying of the stomach is rhythmic and within normal limits. Incidentally noted is spondylarthrosis of the lumbar spine with spurs on the vertebral bodies. Report number 54. Pectus excavatum is usually a benign condition requiring no treatment. Although causing decrease of vital capacity and maximum breathing capacity and increase of residual volume and helium equilibration time, the disorder is rarely associated with cardiorespiratory symptoms. Surgical correction should be undertaken only for rapidly progressing distress in children, impaired ventricular distension, or extreme emotional reaction to the deformity. Report number 55. The left great toe shows a chip fracture of the proximal end of the distal phalanx externally, with no gross displacement of the fragments. Report number 56. Subcutaneous injections of progressively stronger doses of insect whole body extract effectively desensitizes patients allergic to venom of stinging insects. Such treatment and kits for emergency use should be given to persons who have had extreme local or systemic reactions to stings, especially from insects of the Hymenoptera group, such as honeybees, bumblebees, wasps, hornets, and yellow jackets. Report number 57. There is a marked scoliosis at the level of the upper lumbar spine with the convexity to the patient's right. There is associated advanced arthritis between the fourth and fifth lumbar vertebrae on the right side. On the lateral view, the lower dorsal and upper lumbar vertebral bodies show the shape of fish vertebrae. This finding is secondary to osteoporosis. Both hip joints show narrowing of the joint spaces, moderate flattening of the heads of the femurs, and spurs at the acetabulae. These changes are characteristic of arthritis. There is irregular condensation of the bony structure adjacent to the symphysis pubis due to arthritis. There is evidence in the right hand of arthritis, most marked between the distal and middle phalanges. The following are the principal findings. Narrowing of the joint space with irregular condensation of the bony structure in the adjacent area and spurs at the joint surfaces. Report number 58. Live attenuated measles virus vaccine given with human immune globulin provides complete immunity to measles with negligible side effects. Report number 59. The skull films reveal the fragments of the fracture of the mandible on the left side to be in good apposition and alignment. There is evidence of bony callus formation. The fracture line is still visible. Report number 60. Gastroesophageal reflux can exist without radiologically demonstrable herniation of the stomach at the hiatus. In such instances, pathologic changes in the esophagus are due to an unsuspected patulous cardia, which is most likely a precursor of hiatus hernia. The hiatus, formed by the two halves of the right crus, is lax, and the esophagus joins the stomach like the neck of a bottle.